And joining us now is In Focus Health correspondent Linord Moudou. How are you, Linord?
Hello, Vincent. I'm good.
And I know today you have a lot to tell us about swine flu and cervical cancer.
Absolutely. We have a lot on swine flu, as you said, and cervical cancer. First, we start with swine flu. In Kenya, swine flu has been confirmed, and the government has confirmed its first case Monday. Kenyan Public Health Minister Beth Mugo says that the 20-year-old infected with the virus had traveled from Britain to Kenya last week as part of a group of students who are working in the western city of Kisumu.
Since this confirmation, my officers have been monitoring the student. His condition is stable and does not require hospitalization. Meanwhile, the ministry has quarantined the whole group of 30 students staying in a section of Kisumu Hotel.
We turn now to cervical cancer, and in Nigeria, the disease claims the lives of 8,000 women each year. The disease can be a result of infection with a virus that affects millions of women worldwide. Now, a national medical program in Nigeria is raising awareness of the importance of screening for the disease. Jacqueline Mesarawan reports from Lagos.
The World Health Organization says that across the world, one woman dies from cervical cancer every 2 minutes. The illness is often a result of infection from the human papillomavirus, or HPV, which destroys tissues around the cervix, commonly referred to as the neck of the womb. Doctors say the HPV virus is sexually transmitted and that early detection of cervical cancer is critical for its successful treatment. On the street, responses from some Nigerian women illustrate the lack of knowledge about the health issue.
Have you ever heard about cervical cancer? No. Do you know you have to do a test?
No.
Do you think it's important that you should do it?
To me, I don't think that it's necessary. Because
Screening for cervical cancer is a short and painless procedure.
Every woman should go for screening because screening can save her life. And we know that if a woman screens only 2 times in her lifetime, her risk comes down by over 70%. So it's an important thing for every woman to know.
And this is not the time for any woman to start making excuses, oh, I'm too busy, I don't have the time. No. Every woman should take a stand against cervical cancer and say no to cervical cancer. This is the time where I love going by the popular Obama saying that if we believe we can, that yes, we can.
Dr. Egwanwu says there are vaccines to prevent HPV infection, but they are currently beyond the reach of the average Nigerian woman.
We need to bring down the cost to less than $2 before it can become used as a mass intervention strategy.
Children born to women infected with the human papillomavirus are also at risk.
The human papillomavirus can affect the baby once the baby is born, and they come out with papillomatosis, which is a respiratory infection that can finally lead to untimely death in the child's body.
Recently, an event was held in Lagos to raise funds to check women in rural areas of Nigeria for HPV infection and to raise awareness about the medical condition. Some of the women who attended the fundraiser talk about the need for cervical cancer awareness.
My grandmother, at some point in her life, suddenly noticed that she started menstruating again, as she described it. And we discovered that it was not menses, it was actually cervical cancer. And by the time we ran around, it was already too late.
I think it's something that we should give even more attention than we give to HIV right now.
At the Mass Mission Medical House in Lagos, screening costs less than $10. Slowly, Nigerian women are going there to be tested. Doctors say screening for cervical cancer is best done 14 days before menstruation, and a woman should avoid sexual intercourse for 24 hours before screening. Jacqueline Mesarawan reporting for VOA in Lagos, Nigeria.
Thank you, Jacqueline, for this report. Now joining us from Seattle, Washington via phone is Scott Wittet. He is the spokesperson for PATH Cervical Cancer Prevention Program. Mr. Wittet, welcome to the program.
Thank you for inviting me.
Can you describe to us the incidence of cervical cancer in the developing world, especially in sub-Saharan Africa, where some experts say it is the #1 killing cancer? Can you?
Yeah, cervical cancer is a very serious problem in Africa and in other parts of the world. Around the world, about 500,000 women, 500,000 women are diagnosed with cervical cancer every year, and about 250,000 women, 250,000 women, die of cervical cancer. And in Africa overall, that's about 60,000 women a year who die. And these are women in their 30s, 40s, and 50s, so they are the social and economic pillars of their communities and of their families, so it's a tragic loss when they go.
Now, how do you explain these such high numbers, especially in Africa?
I think that you've touched on it in the previous report. The STD, the human papillomavirus, is very common. Almost everyone in the world is infected with it, but it usually passes out of the body. In some women, it persists over time, and they are at risk of cervical cancer. And the screening programs that they were just talking about in Lagos are designed to detect that cancer early so that it can be treated, and early treatment is usually very effective. But in most of Africa and Asia and Latin America, these screening services aren't available to women the way that they are in the U.S. and U.K. and other places. So this accounts for why there are so much cervical cancer mortality in the developing world.
Now, your organization, PATH, has been working to really address this issue in sub-Saharan Africa. Can you tell us about some of your experiences working there?
Yeah, we have two large programs on cervical cancer, one focusing on vaccination and the other one on new screening methods. The vaccination program is rolling out in Uganda just now, and we're seeing very good results. People are very interested in it. To oversimplify, people believe in immunization generally, that this isn't a surprise. They are very nervous about cancer. Even when they don't understand cancer very well, they're terrified of it and think of it as a death sentence. And when they hear that there's a vaccine against a kind of cancer, they say, in effect, if it's safe and if it's effective and if I can access it, if it's affordable, please protect my daughters against this disease.
Okay. Mr. Wittet, that's all the time we have for today. Thank you so much for joining us.
Thank you.
And that's it for today.
Thank you very much, Linord, for joining us today.
My
and
pleasure.
Always remember to watch Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on VOA.